Could you give us kind of the quick and dirty overview, the rundown of just how that works now for people who aren't familiar with it?
Well, the PCPCM, it's quite an interesting new model. It's basically, it takes your original Schedule of Medical Benefits, that lovely 1,200-page book, and we slap a four-part algorithm on top of it. Now, to break it down nice and simple, it basically breaks down your payments into a portion for your encounter, a portion for your direct patient care time broken down by hours, your indirect patient care time broken down by hours, plus an additional payment for your panel complexity. Does it sound confusing? You bet it is. But overall, it applies for a physician, let's say that does longitudinal care. A physician that's looking after a panel. You need to have a minimum of 500 patients to qualify for it. And preferably working in one location. If you're working in multiple locations, that can get really complicated and a bit headache-some. So if you have the qualified panel number and you're practicing that longitudinal care, the physicians I have been working with, there's been a mixed group. Some of them have really enjoyed it. We've had a couple that have found it about as similar to what they were billing before, but on the average, we have found that they have found it has been more easy to be able to track what they're doing. In the past, physicians, for example, with the CMGP modifier, it was per patient and done that day. I've had a lot of physicians tell me that now that they are able to track their time in the amount of hours they spend in a week actually doing that care, and it's not tied to a specific patient, it's given them, they said, more flexibility. They're not having to really track every single little movement with every single little patient and every piece of paper that's related to that patient's journey for that visit. So it's given them more freedom, I have found.